Okay, thank you for from the previous presentator. Hello everyone, my name is Novatisha, and for this activity that we choose, which is the tennis, I will be explaining one of the injuries, which is stress fractures in the back. So the stress fractures in the back, this is the classification, the description, and the characteristic of the injury. Stress fractures in the back or lumbar spine is one of the more recurrent bone injuries in young tennis players. Lower back stress fractures are often distinguished by an ache in the lower back, which is aggravated by sporting activities and alleviated by rest. Although a minuscule percentage of people with a stress fracture can be agony-free. Normally, it is sore when the patient bends backwards, specifically if standing on one leg. If a lower back stress fracture is concluded, a doctor may decide to refer the patient for an examination to affirm the diagnosis to see if it's severe or it can be treated as soon as possible. So for the details of this injury, the lower back comprises of a vertebrae bone regarded as upper and lower pars interreticularis that act as a link or bridge in vertebral procedures of the spine facet joint. When playing sports such as tennis that require repetitive movement and rotation of the spine, a fracture can take place in the pars bone that also causes forward slipping of the lumbar and vertebrae either bilaterally and unilaterally, ensuing in what is regarded as a stress fracture of the spine or spondylolysis. As athletes included in tennis also have higher rate of stress fractures to the lower back. Okay, now I will be talking about signs and symptoms. There are two signs and symptoms found in this injury. The first one is a stress fracture of the back can be recognized by undergoing pain in one side of the lower back, particularly when bending backwards or standing on the leg of the distressing side, or feeling fondness when touching the fractured side of the back. The second one is a curve in the lower back lumbar region triggered by the fracture may be perceptible in more critical cases. There are two types of treatments that can help to reduce, to not severe the injury. The first one is an X-ray, a single proton emission computed tomography scan. It is to ascertain the degree of impairment to the pars interreticularis vertebrae. As I said, if it's to the degree that we can impair, it is wise to do so. The second one is wearing a back brace for 3 to 6 months. The reason is to assist the lower lumbar area, restricting the activity that source the injury, and going physical therapy exercises, which is much more lenient compared to the first option. So for the prevention measures, there are 3 types of prevention that can, prevent from worsening the situation. The first one is take a recommendation from the doctor. If he proposed to unwind and not recommends tennis activity until diagnosis and treatment designated that is innocuous to do so. This is to ensure that we do not fracture any other important organs, or it will be worse. The second one is rotating and stretching your back only when pain-free and pursuing medical counsel equipped to avert further injury or the need of surgery. The last one is a physiotherapist to assist your nourished muscles in your lower back and abdomen if it's deemed necessary. That is all. Thank you.